Maria, can I rename you?
Yes, absolutely.
Well, we are without a chair, and I believe we're without a vice chair. No, Larry's our vice chair. Maybe surprising to Larry because he hasn't been called upon to be the vice chair, but
I'll check Lucy's chair and if it says vice on it or not.
so I think, Larry, we might have to call upon you to be our chairperson today.
I guess I can do that if it's 1 o'clock.
It is.
Well, we called to order Dunn County ADRC, our committee, our advisory committee, and it's Monday, November 15th. And should we do a roll call and see who's here? Can you handle that?
I think I can do that. Yep. So we have board members, citizen board members, Charlotte Lee, Sherry Homestead. We have County Board Chair David Bartlett. We have Transportation Committee member Kelly McCullough, who's a county board person. We have our new ADRC director, Tracy Fisher. You'll meet her in a bit. We have Vice Chair Larry Bjork, who is a county board member. We have our current ADRC manager, Lonnie Dodge. We have citizen member Heather Jerry, Leanne Bartz. We have transportation manager. Close? I don't know. Austin, did I get it close? Transportation manager?
Yeah, transit
All right.
manager.
All right.
You did good.
Okay. Austin Witt, who's on the Transportation Coordinating Committee. Citizen member Maria Bukowski. Citizen member Suzanne Gaines. Transportation Committee member Bobby Higna. And citizen member Carol Kadinger. And
Wow.
Krista Bind is our IT support, and then myself, Chris Corpola.
Thank you, Chris. Sure appreciate that. You know, one of the privileges that today that I didn't realize I was going to have is that I'm going to right off the bat say super congratulations to Lonnie for all her years with Dunn County. I know we've mentioned it a time before, and there's probably a time on the agenda when we'll talk about it again, but as vice chair today, I'm just very pleased to thank her for her work for Dunn County.
Thank you.
Item 3 would be the approval of the minutes of September 20th. Does anybody have a comment on the minutes, or I entertain a motion to accept the minutes of September 20th of our committee? Motion, please. Margie?
I make a motion to accept the minutes. Maria Bukowski speaking.
Maria, okay. Is there a second then to accept the minutes, please?
I'll second.
Thank you. Motion is made and seconded. Is there any discussion on the minutes, or should we just any discussion on the minutes as I call for the just a roll call vote? All in favor of accepting the minutes of December 20th, say aye.
Aye.
Aye. Any opposed, please? Thank you. Motion carried. Number 4 on our agenda is public comment. Krista, do you have anybody that mentioned anything, or somebody out there?
There is no public comment.
Okay. Well, we'll go right to number 5 then. our upcoming meeting date. The agenda says January 17th. And I guess, Chris, maybe you could help me out on this. I was a little wondering today when it's the combination of the ADRC and the Advisory Transportation Coordinating Committee were combined. And then I think historically, haven't we had this and the Nutritional Advisory meeting together? Or it's because nutritional meets every more months or something?
Yeah, so the Nutrition Advisory Council meets, oh, Lonnie, help me out, 4 times a year.
Right.
And generally, unless there's something unusual happening, the Transportation Coordinating Committee needs to meet once a year to approve the 8521 plan, which is on the agenda for today. So, yeah. And then there's probably in that maybe 1 or 2 meetings where it's just the ADRC Advisory Committee.
Okay, thank you. I thought maybe they sent me the wrong sheet of paper when it said Transportation Coordinating Committee, but glad to have those folks with us. How about the January 17th? How does that work for people?
Is it January 17th or January 18th?
The agenda says.
Oh, it is 17th. Yep. Sorry, mine's wrong.
Well, then we'll just schedule that, and that will be back with our regular group with nutrition and ADRC committee. Okay, moving into item number 6, staff report, an introduction of Tracy Fisher. So lucky here today. Tracy, a few words, please?
Sure. Hi, I'm Tracy. I'll be taking over stepping into the big shoes to fill of Lonnie, who is her official retirement date, I believe, is December 1st. But I've luckily been able to start. I started on last Monday, the 8th, so I get some good training time in with Lonnie before she's retired. I've actually been working for the county for 12 years. I was previously the director of social services for the neighbors. So I'm familiar with the county, but I'm learning all about the ADRC. I had a lot of contact with them and I know the good work that they do, but learning all the intricacies of how it works before I officially take over the role. So I'm super excited to be here. It's a great group of folks and I really look forward to it.
Well, thank you very much for accepting the position. And if you come from the neighbors, you know, things have to be done right. So thank you.
Absolutely. That's the case.
Any other questions or comments from somebody? We're real happy to have a new member here or new director. I'll tell you what, the more I learn about ADRC, the more I like about it. And because prior to the county board, I haven't had any experience with it at all. And I think it's an important part of Dunn County and what they offer to the residents and something we really should support. Okay, no other comments. Next one, the change of oversight of elder abuse and adult protective services that will come in January of 22. Who will be speaking to that, Chris?
I will do that.
Okay.
So I just wanted to make you aware. So historically, in Dunn County, adult protective services and elder abuse services were located in the ADRC. So the difference, why they have 2 titles, the difference is adult protective services deals with vulnerable adults up to the age of 65. And then elder abuse services deals with vulnerable elders 65 years of age and older. And so I believe we've talked about this before, but an example of a vulnerable adult would be we did an APS investigation, Adult Protective Services investigation, when a young woman who was cognitively delayed and lived with her mom's boyfriend was asking to take naked pictures of her. and she was not of the ability of, to have the cognitive ability to consent. And so that was reported to us, and that would be an adult protective service investigation. Elder abuse services, and we'll dig into these a little bit deeper in a future meeting. Elder abuse services are oftentimes, there's two probably primary areas. Thankfully, we don't receive a lot of referrals regarding physical abuse or sexual abuse of an elderly person, but we do receive self-neglect, where people are not able to take care of themselves, or financial neglect or financial abuse, situations where someone's taking advantage of someone financially. And so we will spend a future meeting talking about that. So historically, those services were in the ADRC. County by county, I'm sure some of you have heard this adage, or may even have heard me say it. They say, if you've seen one county, you've seen one county. In Wisconsin, things look differently sort of as you go from county to county, and that is true of adult protective services as well. Sometimes they're in behavioral health services, sometimes they're in the ADRC, sometimes the same person who does child protective services does adult protective services. So they sort of vary from county to county. But in our county, we moved them from the ADRC to behavioral health 2 years ago when Lonnie came on, because Lonnie's predecessor, Sarah Olinger, had just really gotten her feet wet in the APS world and had kind of knew that. And Lonnie was going to come in and learn a whole new program. So we moved APS with Sarah to behavioral health. But now that we are kind of have stabilized and Sarah has some additional responsibilities in behavioral health, we are going to move it back, and Tracy will assume responsibility for oversight of that program on the first of the year. So that will give us a little bit more depth in behavioral health, for Sarah to do some other things. And it fits really, really well with, so the ADRC staff take those reports. And it's about ballpark 160 reports a year. So their staff take those reports, and then oftentimes when you're looking at coordinating services for folks, it drops immediately into the purview of the ADRC. So we are just going to make that change on the first of the year, and I wanted you to be aware of that. And probably shortly after that, we'll do some adult protective services, just whatever, tell you what the program's about.
I have a
Overview.
question.
Yes.
I have a
Yes.
question.
Yeah.
This is Margie. Are you just looking at the elder abuse, or are you looking at the whole adult
They're-
protective services and elder abuse?
Both.
Okay, both. Okay.
They're both going back to the ADRC. We
Okay.
call it all APS, adult protective services, but it really does have kind of two categories to it. It's just they kind of title it by what it's funded most by, but there are two populations, although the investigations look very much the same.
Okay. Thank you.
Thank you. Any other questions, comments?
Is there going to be more staff to deal with this, or how are you going to make sure that how are you going to deal with that if you have another responsibility?
So the staff that have been responsible for the investigations are moving as well back to the ADRC. Actually, they've never moved. They've been co-located there. But it's just the oversight of the program that will move from Lonnie, or from the behavioral health to the ADRC.
Okay.
Okay, good questions. I guess I had one, Chris. Is this like when you go to the doctor now, and person my age, they ask if you feel safe at home, if you've fallen and all that kind of stuff. Is that sort of reporting that you're talking about probably?
It could, sure. It could be. I mean, those reports, just like in the world of child protective services, those reports come from many different spots. Might be a neighbor or a friend who's concerned about someone's something that's happening with someone that they're, you know, that there's a area of concern for their safety. Could come from a physician, could come from a law enforcement or a first responder. So lots of different sources of could come from a bank. I'm sure that you probably remember me telling you the story of when Betty Zimi was on our committee, and Betty was also a member of our interdisciplinary team to look at addressing issues related to adult protective services. She was able to flag, working at the bank, someone who was potentially being taken advantage of financially under a scam. And so that referral came from the bank. So they come from kind of all over.
Can it also
No,
come
that's-
from a family member?
Absolutely.
You know, that's a good point on the scam thing. I never even considered that. I mean, you know, all this electronic information and, you know, even the county's had its problems on paying bills, or that money ends up where it's supposed to be. I mean, that's a whole new ballgame, isn't it?
Yep. It
Okay.
is.
Any other questions? Sure.
I have one quick question. These reports, as they're filed by any number of people with relationships to the person that they're filing on, what is the feedback? Are they given feedback as a result of that report, or does that bump up into HIPAA kind of laws, or?
Yeah, it's not HIPAA per se, but it is confidentiality rules that yes, you can report, but you're not necessarily able to know the outcome to that report. Again, similar child protective services and adult protective services look similar in that sense, to encourage reporting, but also to maintain the confidentiality of people.
Right.
It is, yeah, there is little feedback. I mean, oftentimes, just like, I'll call it light feedback, you know, just about that's something that we will look into, or we, you know, yes, your referral meets the kind of criteria for which something that we would look into. But that's about the extent of it.
Thank you.
Any other questions or comments? Been real good discussion, by the way, real informative for everybody. Well, should we move then to staff report item C, the need of one ADRC board member? And Chris, where do we go for that?
I could do that. We are in need of one additional member. Because this committee is pretty large. It's 11 members, which is a fairly large committee. And because there are a lot of citizen members on this committee, only 2 county board representatives, we do have a fair amount of turnover. And Margie Steinecker is unable to complete her term, an appointment to this. So if you are aware of anyone who would like to join your ranks, we are particular, there's just not a tasteful way to say this. I don't even know how you say this. We are looking for someone. So you fall into 2 categories of participation. One is that you are over 60 or over, which I think all of us practically, except Tracy and Lonnie, maybe. I'm not sure about Kelly, how old Kelly is, so we won't make him 60. But anyway, so we get to 60 or older, or the other category is that you are either physically disabled, developmentally disabled, or have a family member, or, you know, a kind of immediate connection to someone who is. And so we are looking for someone, if we can find someone who's representative of the community, from the community, that has a physical or developmental disability, or a family member thereof. That's our spot that we're most looking to fill. But at this point in time, it's kind of like a meeting I was just in. Almost everybody kind of knows someone who's been, has a physical or cognitive disability, developmental disability. So we can probably stretch that a bit. But if you know of someone, send them Tracy's way, and we will make connections to gauge their interest, get some information, and get that information to Chairman Bartlett for an appointment if to this committee, if that person's willing and interested in serving.
Thank you, Chris. I know personally myself, I'm glad to add a few years above the 60 to bring the average up, you know. Happy to help where I can. Nope. Okay. Well, I guess another thing on board members, I'm always anxious to, have people spread out about the county, and I don't know how that goes about and how long we're going to be Zooming. So, I mean, a person that has some direct knowledge with cognitive persons or real sincere wanting to help, this Zoom makes it pretty easy to be part of a committee. So, I mean, let's take advantage of what we got for as long as we got it, I guess. So it's not my favorite, but it works good today. Anything else then on the board member? Anybody have any questions? I think we'll be able to find somebody. I was surprised to find out that there's 11 members. I guess I've never really considered or even looked at the number of people. So, okay, then moving on the agenda, we'll go to number 8, actions taken by the Transportation Advisory Committee. These are the guys that threw me off today. I thought, geez, they must count me at the wrong meeting. So, but when it comes on the computer from the county, so far it's been right. So here I am. So what do we do here?
All right. Well, let me give you some background, and then I'll have Lonnie speak to the plan, just because we are going to have we do have a short meeting today, so can pontificate for a moment about sort of all of this. You will hear us reference 8521. And actually 8521 refers to a section of the Wisconsin statute that basically creates this allocation or grant, if you were to say, from the Department of Transportation to the counties and or aging entities. And I'll talk about that in a second, for the purposes of providing transportation services within the county. So transportation falls under aging programs. So our ADRC encompasses both ADRC programming, which would be information assistance and options counseling and eligibility determination for publicly funded long-term care, as well as our disability and our benefits specialists. All of those are part under the umbrella of the ADRC. And then the aging programs are our caregiver supports, our nutrition program, and transportation. And so transportation falls under that aging purview. And aging programs can be provided by county entities, like the county itself. They can be provided in collaboration with your ADRC. They can be provided by another private or nonprofit organization. And the county has a responsibility to determine that they'll be provided, but does not necessarily have to be the provider. In Dunn County, we are the provider as well of those services. And so therefore, taking forward this recommendation, we annually have to prepare a plan as to how we're going to expend our 8521 allocation, and that needs to be approved on an annual basis by the Transportation Coordinating Committee. So Lonnie, do you want to speak to the plan?
Well, I'm trying to pull it up and I can't get it pulled up right now.
Do
Okay.
you want me to do it?
Well, I think I got it.
All right.
I don't have the little summary that you made, but okay, the plan is we have two projects going and one of them is the Dunn County Transit Doorstep bus. And that is the project where a bus travels on a 1-hour loop during business hours. And people can call and schedule when they want to get picked up and dropped off. The second project is a volunteer driver program where we have volunteers that will take people to appointments. And all this is run through Dunn County Transit. We just approve the volunteer drivers and then everything is, the rides and stuff are set up through Dunn County Transit. And this year, our total funding is, that's what I'm trying to find, Chris.
No, $119,859.
Thank you.
What was that again? Repeat it, please.
119,859.
Thank you.
And then that comes with the requirements that the county match it by 20%. So the county match is $23,972. So if you added those two things together, you would be just under $150,000. So the doorstop bus service, we do little with other than passing the money through to Dunn County Transit. And we have over the last several years passed through to them the base grant or allocation of $119,859. That it's different each year. It goes up a few $1,000s each year. I think this year it was 118 something and now next year it's 119 something. So it wasn't even a few $1,000s this year, just about 1,000. We pass that money through to Dunn County Transit for the doorstop bus. And again, that's for persons who have some mobility issues, which preclude them from using the established bus routes and the regular transportation services through Dunn County Transit. And then we also claim a little bit of administrative costs to that. And then, so we add, and I put this on the bottom of the page, the funding formula for this grant seems complicated, but it's fairly easy. It's the grant plus the 20% plus whatever revenue that we bring in that people pay for their volunteer driver services. So when someone goes on a trip, say they're going to go 100 miles, and we reimburse the driver the IRS mileage rate, which is right around 56, 55, 56. Sometimes it's been as high as 58 cents a mile. It changes annually. So 100 miles, the trip costs $56. And we ask the participant to pay half of that. So in this particular case, that would be $28 that they would pay towards that. So that revenue goes back into the sort of the pot. So the funding formula is the grant plus the match plus the revenue. And when all of that's sort of said and done, and all of that is expended, then we need to have spent at least the grant plus the match. I know that sounds more complicated. It sounds complicated. It is relatively straightforward. But so we have to subtract out revenue, or we have to account for revenue that we received, because the 20% has to be money the county is spending, not money the county is getting from someplace else. And so we have to do some math at the end of the year, usually, to balance all of that out. So we do claim the money passed through to Dunn County Transit, whatever we pay out to the volunteers, for their driving time. We have a little bit of administrative costs that we claim in that for administering the grant. And then at the end of the year, we look at that closely and say, have we spent the grant and the revenue, or the grant and the income from the drivers, revenue from the drivers, and the match? And if not, then we true up with Dunn County Transit for the difference. It's usually a nominal amount of money, a few $1,000s at most. But that's how this project works. So, questions about that?
I just have a question, Chris. Do we ever get into sharing programs with sort of like the veterans with Greg?
We do.
Say like, a trip to Veterans Hospital and stuff like that. Then it's a
Yep.
shared.
Yeah, actually, there's a lot of collaboration that goes on between the veterans and our agency, New Freedom, which does the veterans transportation through the Center for Independent Living. There's a lot of coordination. So if I'll tell you a very common scenario of someone that would use a volunteer driver. Let's say that I am 65 and I am diagnosed with a kidney disorder and I need to go to dialysis 3 days a week. And maybe my daughter takes off of work one day to take me. And actually a better example actually is one that we get pretty commonly is someone who's going to radiation, where I probably shouldn't be driving myself. So I have to go to radiation 5 days a week in Eau Claire. Maybe my daughter's going to take me one day, and maybe my son is going to take me one day, and my neighbor is going to take me one day. But I still have 2 additional days to cover. Then I might utilize volunteer driver services for that. And so once we get that request, then we merge all those various spots to get somebody sort of the best deal to get the services that they need. So that would include using VA money, using the New Freedom transportation, using the volunteer drivers, however we might be able to best meet that need.
I think another need that I think, if I'm remembering right, if it comes through this group or not, I think we had a county board member that had a medical procedure. I don't know if it was a knee or whatever it was, but isn't that available then to help a person get to like their rehab? You're not supposed to drive, and you've had surgery and you need to go to the rehab.
Both, either might be possibilities. But if you live within the city of Menominee and you can use the Doorstep bus, and I believe, Sarah, was it you that tells the story about utilizing Doorstep bus services?
Yes, I had a broken foot, and that was the only way I could get back and forth to the healthcare center to do light duty. And it was wonderful.
Yep. So it's a great resource in town.
Expanding on that, with what we're talking about here too, with us only having right now 2 volunteer drivers, anytime somebody's even close to the city limits, we really try to steer them towards the Doorstep bus, because we know that's running 10 hours a day. If sometimes, instead of that being a volunteer driver, especially if it's a Menominee appointment, they're not making hardly anything on mileage and they might be tied up for half the day. So that's another good reason to use the Doorstep bus. And a lot of times ADRC buys tokens for the Doorstep bus. So it's a win-win if we can pair it up with the Doorstep bus. And if anybody knows anyone that might like to be a volunteer driver, there's a lot of calls we have to turn away because our 2 are already booked or are not available those days. So please reach out if so.
Thank you.
The volunteer driver program took a pretty hard hit with COVID.
Yes.
What I was gonna say, it's, nobody wants to really drive sick people anywhere, and a lot of people don't want to ride with like a stranger either, so it kind of goes both ways, so yeah, but we could use more volunteers. And I was gonna say, I think at the end of last year, we had some funding left over, which we did purchase like a couple $100 in tokens. Then we could hand those out to people as they needed them too, so that worked out good.
I also saw in the past that ADRC purchased monthly bus passes for our community bus. And now with that being a free fare, that is money that can be put towards doorstop tokens or something else. So for anybody that doesn't know, starting last June, the community bus does a 1 hour loop around town to most of the stops it did previously, but it's the same 1 hour loop 8 times a day, and it's free to public, students, and everyone. So
Good, thank you. Anybody other discussion? This has really been good. Welcome, Sarah.
So basically, we did not print you the actual plan. We did the summary that tells you the dollar amounts that are involved, just because the plan is a bunch of budget lines, or it's a bunch of empty lines, honestly, because our plan is pretty short and pretty succinct, but we do need your approval of submission of for this funding for the next year.
Kelly, do you have anything you wanted to add from the highway committee?
No, but I was gonna go ahead and make a motion to approve the funding application as presented. Oh, and by the way, for the record, 54
Thank you.
from the earlier age discussion.
I'm glad to give you a few years, man. I feel better already. Motion has been made. Entertain a second, please.
I'll second.
A motion has been made in second to approve the 2022 58.21 transportation funding application. Is there any other discussion on the motion?
I'd just like to say, I think it would be helpful if some of us would actually take the doorstop bus sometime, just to have the experience and know what we're talking about. I think it would be a helpful thing for all of us to at some time take it.
Thank you. I would agree.
with Kristen, with this form, a lot of times, or I've just sent my information quarterly to Nathan for the 8521 for submitting this in Black Cat. Is this ball not in my court? I see it is not submitted, and I can open all of this information, but is it your department that actually submits this specific one?
Yes, the plan.
Okay. Yep.
Yes.
Awesome.
Yes.
Sounds good. Thank you.
Great. Okay, a motion made and second. Any other discussion? Okay, we'll call a question on the motion. All in favor of the approval, signify by saying aye.
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 Opposed, same sign. Motion carried. Well, thank you, everybody. That takes care of a real important piece of business. You know, before we talk about adjournment here a minute, you know, at the bottom of the agenda pages that they always send out, and you got to let your eyes fall on the vision statement. We are the leadership that advocates for health, safety, and welfare of Dunn County. You know, that's a bold statement, and I think we make a great effort and achieve a high degree of success in that vision statement. Thank you, Chris, for leadership in that. Is there any other discussion prior to adjournment?
I just
I've got
like
a
to say,
question.
Yeah, go ahead. Chairman Bartlett, go ahead, please.
This grant, Kristen, how soon does it need to be signed?
It actually doesn't need a signature. It
Oh,
has a submission process within a computer web-based submission, and then actually Paul Miller has already signed off on the actual there's some part that he has to commit to on behalf of the county, so.
Okay,
Once-
thank you.
Once I get the notes, the meeting notes, I can submit it and it will be done.
Okay, any other discussion? I believe there was somebody.
Yeah, I had a question. I always seem to have trouble getting on for these meetings. And part of it is I'm looking for who is sending out the agenda. Is that you, Chris, or is it Sarah? Or who actually sends out the invitation?
Well, I generally send the invitation for the Zoom meeting, but the agenda actually comes out both in paper form and like the paper form through Denise through our administrative support through the ADRC. But I typically send the meeting invitation for Zoom.
Okay, so when I look for the invite for the Zoom meeting, I look up your name. As
Hopefully
a
gets you
contact.
there. Yeah.
Yeah, okay.
Or if you don't have it, ship me a quick message and I will correct that. Just after the meeting starts, I don't see my messages pop up. So it's got to be like a few minutes beforehand, but.
Right. Well, I tried looking up Sarah and thinking it was coming from Sarah and it wasn't. So obviously, okay. All right, thank you.
Okay, Sarah?
I just wanted to say I'm sorry I'm so late for this meeting, but this county computer does not like me. So hopefully it'll work right the next.
The only comment that I would have about the computers, and I'm in Lucy's office because we're having trouble at the farm, and I didn't have to scrape the ice off the window of the computer to talk to you folks today, so that was a good thing.
We all need to get on about 10 minutes ahead of time.
Anything else? And thank you for the great discussion, everybody.
My computer would not start at all. It just was black. It was just blank and it would not start at all. I had to have someone from IT go into it to get it to start it off. So.
It was cold.
I went pretty black when Chris said that the vice chair was going to start the meeting. I know I blacked out there for a few seconds. Anything else, anybody, please? Well, then we'll just call the adjournment of the meeting, or do we need a motion to adjourn, or just?
Nope, you can just call it done.
Call it done, and thank you, everybody, for your participation today, and looking forward to